What is RSV and how does it affect babies? Imagine a tiny virus that can cause big trouble for the smallest among us. That's what respiratory syncytial virus, or RSV, is. It's a very contagious virus that infects the respiratory system, including the lungs and airways. RSV is one of the most common causes of respiratory illness in infants and young children worldwide. Most people, including adults, will get RSV at some point, often during childhood. In healthy adults and older children, it usually causes mild symptoms like a cold, but in babies, especially those under 1 year old, it can be much more serious. RSV spreads easily through tiny droplets when someone coughs or sneezes. These droplets can land on surfaces and stay infectious for several hours. If a baby touches a contaminated surface and then touches their eyes, nose, or mouth, they can become infected. RSV tends to be more common during the fall, winter, and early spring months, similar to the flu and other seasonal viruses. In babies, RSV often begins with symptoms that look like a common cold, such as a runny nose, mild cough, and sometimes a low fever. But in infants, especially those who are premature or have health issues, the virus can quickly become more serious. It can move into the lower parts of the lungs, causing bronchiolitis, which is inflammation of the small airways, or pneumonia, which is an infection of the lungs. These conditions can make it hard for babies to breathe and may requiring medical care. Signs that RSV is causing more serious problems include rapid or shallow breathing, visible effort to breathe such as chest pulling in with each breath, wheezing, poor feeding, unusual tiredness, irritability, and sometimes pauses in breathing called apnea. In severe cases, babies may develop a bluish tint to their skin, lips, or nails, which indicates low oxygen levels and needs immediate medical attention. Most babies recover from RSV within 1 to 2 weeks, but some may have ongoing respiratory issues or wheezing afterward. Babies who are born prematurely, have chronic lung disease, congenital heart problems, or weakened immune systems are at higher risk for severe RSV infection. These infants might need hospitalization for supportive care, like oxygen therapy or help with feeding. From the perspective of influenza, RSV is another respiratory virus that can cause serious illness in babies, similar to the flu. Both viruses can lead to symptoms like difficulty breathing and sometimes hospitalization. However, RSV is different from influenza because it mainly affects the lower airways and often causes bronchiolitis in young children. Both viruses spread in similar ways, so good hygiene practices like hand washing, avoiding contact with sick people, and following vaccination recommendations are important for protecting infants. If a baby shows signs of severe illness, such as trouble breathing, poor feeding, or extreme tiredness, it is essential to seek medical advice promptly. While there is no specific antiviral treatment for RSV, supportive care such as oxygen, fluids, and help with breathing can help manage symptoms and prevent complications. For babies at higher risk, preventive treatments like special antibody injections may be recommended by healthcare providers. Always consult a healthcare professional for personalized advice and care when caring for a baby with any respiratory illness.